Welcome to today's 10-minute CEO interviews. Today I have a guest. His name is Nick Tzapsidis. He is from New York and he is the CEO and founder of Neurotez. Neurotez is developing a drug to treat leptin deficiency in Alzheimer's patients. This is very interesting, Nick. The reason is my grandmother had dementia, so always it's on the top of my mind. So welcome to the show, Nick.
Thank you very much. Real pleasure being here.
Good. So tell me a little bit more about your company and what you're doing with Neurotez.
So Neurotez is a private biotech company. We have been around since about 2005 with technology that started off at Columbia University, which was my last academic post. And ever since 2005, we've been trying to do all the necessary steps towards an approval of our primary asset, which is leptin, as a treatment and as a drug for a specific subgroup of Alzheimer's disease patients, characterized by leptin deficiency.
Right.
And all this is based on years of preclinical work that utilized cell culture and animal models, in addition to a vast number of studies that were epidemiological in nature, demonstrating and supporting an association of low leptin and high risk for Alzheimer's disease. So it's a combination of preclinical work in cell and animal models and some clinical data from humans, including interventional studies, although those are very small in number. Nonetheless, demonstrate leptin's ability to modulate structure and function of human brain. Admittedly, those human studies were not done with Alzheimer's patients. This is what we need to do to move forward with the development of this asset.
So Alzheimer's, dementia, it affects millions of people. I think like 5 million and 40 million patients worldwide. So,
Correct.
But where is this at? Is this pre-testing to diagnose possible dementia, or is it going to help current dementia patients?
Ideally both. First of all, the assets that we are developing is a repurpose effort, meaning that the drug has already been approved for a different indication, meaning that we are effectively phase 2 ready, because all the safety and tolerability aspects of this compound are fairly well known. We missed the part about safety and tolerability on Alzheimer's or elderly patients, and that's something that we have to address in our initial clinical trials. However, because of its relatively safe profile, it is something that we can use to treat individuals early on in the stage of the disease. And our belief, and all the field believes that too, the earlier you start with treatments for those that are in the early stage or even are in danger of getting Alzheimer's disease, the better off and successful you're going to be in achieving some efficacy in slowing down the deterioration that is characteristic of Alzheimer's.
Yeah, this is interesting because we're very real right now with the coronavirus, and a lot of the patients' lethality deaths are from assisting living centers. So if you can bring out a drug that stops the process of dementia and still live at home, that makes sense.
Oh, absolutely, absolutely. And more or less, also, not necessarily needing a caregiver for administration of the drug is very important too. If the earlier stage you are, you're still very functional. Not only in terms of living home versus living in a daycare center. Overall, you're more functional as a human being. And if you can administer the drug yourself, it's going to be much easier for achieving your goals, or the drug's goals, or the physician's goals.
So tell me, Nick, why did you start this company now? What was the impetus to get going now and bring it to the market?
Well, obviously, we're dealing with a big problem. As you mentioned earlier, there's 5+ million in the US. I think it's 5.7, the latest figure, and more than 40 million of people around the globe. So we knew when I was doing research as a scientist that Alzheimer's disease was a huge indication, that it was something, it's a huge unmet medical need because right now there's no drug that can treat Alzheimer's disease. There's a few medicines out there that provide limited symptomatic relief. However, they're very narrow in what they can achieve. So there's a huge need for what is called a disease modification entity, a drug that will halt the disease or stop its progression rather than just simply treating the symptoms. And when I was at Columbia, we did some studies with this particular compound, and they were compelling in nature. That also compelled me to leave academia and start a company to address this. It's a little bit more difficult dealing with drug development projects in academia. It's much more difficult to raise funds for it, etc., from institutional investors, etc. A company is a better setting.
Right.
That's what we did. That said, our initial funds came from the NIH. We applied for grants. We got non-dilutive capital, and we did all the preclinical work leading up to the point where we are now, ready to start clinical trials.
Yeah. It seems like the timing really is starting to favor you because, current administration is giving everybody in the United States the right to try. And
yeah.
I got to believe now, but you're not really talking to the parent with dementia. Are you talking to the adult child, maybe taking care of Alzheimer's dementia patients?
Well, as I said, the earlier stage we start, the more of an impact the individual patient to be, his decision would be. They would be able to, consciously decide, I'm going to start treatment because, one, I have low leptin, and I didn't mention at the beginning, it's one of the ways by which we're going to be selecting that specific subgroup of Alzheimer's patients. They will have, in order to qualify for the treatment, they will have to have low leptin levels. And it is, in fact, a phenotype that you see in a lot of Alzheimer's patients. Leptin levels do go down. So select for their low leptin and some genetic markers that will determine whether they have a genetic predisposition, in addition to early signs of, memory loss or memory impairment, would be the perfect candidate for this drug. So we do the leptin determination. We monitor the leptin levels during the clinical trial. We do the genetic testing. We are collaborating with a company out of the UK called Cytox. They have a panel of SNPs, and they use an algorithm that they are testing in order to select for genetically predisposed individuals. And all we're going to do is supplement the leptin levels to get them to reach to the high quartile from the lower quartile, which we're going to be starting from. Perfectly safe strategy, and based on compelling data that support a pro-cognitive role for leptin for this compound.
Where are you at right now with the company? I mean, I looked on the website, you've got some distinguished people on your team. What are your biggest challenges? What's happening like right now? And then the next thing I need to do is this.
Funding. Right now, we're trying to raise the capital that we need, and it's always substantial when you're doing clinical trials. In particular, Alzheimer's, you need a lot of capital. One, because clinical trials in general are very expensive compared to the previous preclinical stage of drug development. But in Alzheimer's disease in particular, you're dealing with a relatively long treatment. In order to demonstrate that your drug is going to be effective, you're going to have to demonstrate that it will have an impact in cognitive parameters. And in order to statistically demonstrate efficacy, usually the trials are in the order of a year, if not longer. So the longer the trials, the more expensive they become, et cetera, et cetera.
How much? How much are you trying to raise?
At this stage, we're trying to raise 10 million that will get us through what is called a phase 1B trial. The phase 1B trial will be a portion addressing safety, and it would also include some Alzheimer's patients in order for us to get a biomarker readout, see what the treatment would do to certain biomarkers in the patients, and also study a little bit pharmacokinetics of the drug in that specific group.
Yeah.
As a secondary endpoint, we will also include a memory test that has been developed by our Chief Medical Officer, Dr. Ashford. It's a digital app that will allow you to very easily score your memory, episodic memory levels. And that can be applied on a daily basis. We'll be able to monitor it very easily and very effectively.
And that's part of the FDA test, or
it would be part of the trial, but because that initial trial is only going to be relatively short, we anticipate 2-3 months in order to get a biomarker readout. It won't necessarily give us a strong indication as if it's going to be beneficial cognitive performance-wise. But with the MEMTRAX test that we have, we may be able to do that even.
Yeah, I think you can. I mean, as they say, if you don't use it, you lose it, right?
Right. Yes.
Yeah. Right. So tell me about a little bit of traction, major milestones that you've hit that said, look, we're heading the right direction. Things are turning our way.
First of all, we did all the preclinical work that was needed in order for us to be in a position to start clinical trials. We have also, because it's a biologic, meaning that it's a little bit more complex of a compound compared to the small compounds that you see developed by pharmaceutical companies. It's more complicated. You need a lengthy and detailed manufacturing process. And we've done all that. We have worked with a contract manufacturer. We have a drug ready to be entered in what is called the GMP suite to produce clinical grade protein. So that is a relatively important milestone. We have applied and have patents issued around the globe, and that includes geographies like China, India, Japan, Australia. We have 3 in the US, and we have patents pending in Europe and Canada. These are major milestones to secure the commercialization and marketing aspect. And because it is a biologic, we are fortunate to be assisted by the fact that they get extra years of market exclusivity from the date they are approved, and this applies to the US, and there are similar provisions around the globe. So in addition to the patents, as a biologic, it has extra protection. The next most important milestone would be to secure the funds that we need for the clinical trials. And that's really where
it seems like the larger pharmaceutical companies, they wait for you to be able to ante up to the game with the pharmaceutical trials to say, hey, they made it this far, let's keep an eye on them much more, and if anything happens good, we're behind you.
You're absolutely spot on. The crucial phase or spots for a company, or milestone for a company of our size and stage, is to deliver positive phase 2 trial data. And phase 2 refers to the clinical trials that you usually do with patients and you check for safety and efficacy for your compound, but it is relatively small and may not necessarily be enough to allow the drug to go to the market. So a big pharmaceutical company comes in, and then they do the larger clinical trial, exactly identical to the one that you just did in the phase 2, only differences with larger number of patients in order to satisfy FDA's requirements for, the company to demonstrate safety and efficacy in large.
You've been teaching university, you've been working on this for years. So I'm going to ask you something personally. I mean, what's the why that's really behind you, motivated? Do you have parents with dementia?
My mother, she was diagnosed with Alzheimer's before, she succumbed to the disease. And equally, my wife's mother also recently died with Alzheimer's disease. So we have personal interest, not only because, the risk of us, me and my wife, becoming Alzheimer's patients, our daughters are going to have potentially a double genetic risk coming from both parents. So it's very, very personal, very, very personal.
Gotcha. Yeah, that'll inspire you much longer than any type of money being thrown at you.
Absolutely, sure,
yeah.
Sure.
So I'm going to ask a very question. I know that you're not going to. Our current vice presidential candidate from the Democratic side is interviewed almost daily by news networks and is displaying behavior that I've had parents with Alzheimer's dementia. Some of the things they're saying, it looks like he has onset dementia.
Yes. Although any statement coming from me may have, some political implications, but I agree with you. And, maybe we can help as a company. He can come over and then we can get the leptin levels determined and do some memory tests with the memory tracks, and also do the genetic test to see if there is a predisposition or a genetic risk for Alzheimer's. We'd be happy to provide a solution if there is a problem. Again, it will have to be a perfect match. For our treatment, we will need individuals, as I said, to have low leptin levels, to have some genetic predisposition. ApoE4 is one of the markers that is most prominent in, driving a risk, and some memory impairment, some cognitive impairment. The initial stages of the disease, they're the perfect candidates for us. And we strongly believe that will be a meaningful solution for them.
I have to ask you a personal question, since you've studied this disease much more than I have. Is forcing your body, let's say he does have early stages dementia, does forcing energy out of somebody that's required, the energy required of running for a campaign, does that accelerate the disease?
No, if anything, I think it will be beneficial. The more exercise, both mentally and physically, you do, the more likely you're preserving, functionality of neurons and muscles, right? So you mentioned the phrase earlier, use it or lose it. That applies very, very much so.
Gotcha.
Yeah.
So tell me, this is back to personal. I know you both sides of your parents had it. So what's the why that makes you cry? Like every morning I get up and I need to do this. I have to do this. This is my life's mission. What is that?
Well, this is a major part, right? I wake up and all I think is, what do I need to do next in order to forward this opportunity towards commercialization and approval from the FDA, right? But generally, what makes me cry is misery and suffering. I know how much Alzheimer's disease patients suffer. I've seen it in front of my eye as she was deteriorating in a relatively, rapid fashion. Her personality changed, behavior changed. At the end, she wouldn't recognize very close people. within our own family. That's huge. And then anyway, I want to get into the details. And the other thing that makes me cry is, believe it or not, beauty and creativity. If I see somebody performing a nice song, it will emotionally charge me. I try to hide it, but it's the truth. I do get, and creativity in general. When I see something nice, it's.
So what is the kind of music you like?
Oh, there's no particular preference. Any kind of music, as long as it's well done, I will listen to it. Depending on my mood, anything from rock and roll to classical to opera, I'll listen to everything.
So what kind of, are you like UK rock and roll bands, the Stones or Who or?
Yeah. I grew up with those guys. So.
Yeah, that's beautiful. Nick, thank you so much for joining us today. This is the 10-minute CEO interviews with Nick Tzapsidis from Neurotez, CEO and Chairman. So thank you so much for today. This is a great interview.
Thank you very, very much.